A group of more than 150 St. Charles Bend technologists have notified the hospital of their intent to strike in 10 days. Negotiations stalled late last year on a fair labor contract between the recently unionized group and the hospital. Jack Hirsch has more on the situation.
Harris Leslie has worked at St. Charles Bend for the last 6 years.
I specialize in the heart, so I do all types of different ultrasound procedures on the heart.
Leslie, a cardiac sonographer, is one of more than 150 St. Charles technologists who are intending to strike if the hospital does not resume negotiations on the group's first union contract.
My compensation is not at what would be an appropriate market value for the area.
The group includes respiratory therapists, critical to the fight against COVID-19. Samuel Potter, a representative from the Oregon Federation of Nurses and Health Professionals, which is helping the negotiations, says the risk was considered. The intent to strike vote passed overwhelmingly, 94% in favor.
We're willing to do whatever it takes to finish this contract before the 10 days is up.
In a statement, St. Charles says the groups were in discussions with a federal mediator and had a date scheduled on March 10th. Rebecca Berry, Vice President of Human Resources for St. Charles Health System, said if ONFHP believes that progress is not being made, it needs to look at its own decisions. Potter says the contract was 85% complete when St. Charles left the table in December. But St. Charles says it was waiting for the union to respond to its last negotiation offer.
Two things are kind of remaining on the table. Fair wages and respect.
And Leslie says a resolution will result in the best patient care possible.
We really care about our patients.
St. Charles says it plans to file an unfair labor practice charge of bad faith bargaining with the National Labor Relations Board. In Bend, Jack Hirsch, News Channel 21.